Now we have to talk about venous drainage of the brain and cranial cavity. And for that purpose, we have to talk about some dural venous sinuses. What is dural venous sinuses? Actually, there is a double fold of durameter. And what is inside the double fold of durameter? Dural venous sinus. So it is intradural. Yes, it is intradural. Actually, we have to understand that durameter has two layers. One is meningeal layer, one is endosteal layer. So durameter has two layers, meningeal layer and endosteal layer. Yes. And they split to enclose the dural venous sinus. So telling this is durameter and splitting to enclose the dural venous sinus. Yes, actually there is towards the brain, meningeal layer, and towards the skull, it is the endosteal layer. So this is durameter. Yes. And it has two layers which are fused with each other. Yes. Towards the brain, which is it is meningeal layer, and towards the skull outside, it is endosteal layer. And then this sometimes separate. Yes. When they separate, what is there? Dural venous sinus. And what is inside dural venous sinus? Venous blood of the brain. That is the venous blood of the brain. So you are telling that durameter will split to enclose some dural venous sinus. Yes. And in that is the dural venous sinus. Can you discuss some venous blood now in the dural venous sinus? Yeah, let's do that. Let's do that. And now this is the diagram for the drainage of the brain. And what is this diagram showing? You have to discuss some dural venous sinuses, like magnify the diagram you see. What do I see? You will see superior sagittal sinus. Why it is superior? Because there is inferior also. Or there is a superior inferior. Yes. Why you say sagittal? Sagittal because anterior to posterior. So sagittal. So there is a superior sagittal and there is inferior sagittal. Yes. Where is the superior sagittal, inferior sagittal sinus draining the blood into? That we'll find out. But then there is a great cerebral vein of Galen which will join the inferior sagittal. Now, when the great cerebral vein of Galen will join the inferior sagittal, what they form? They form straight sinus. And straight sinus is joined by? The straight sinus is joined by superior sagittal. So that together they form the confluence of sinus. This is what we have to discuss. And where the confluence of sinus is going? Confluence of sinus will be going to drain into what? Into this transverse sinus and then sigmoid sinus and then the internal jugular vein. What is that? There will be a transverse sinus and the sigmoid sinus and the internal jugular vein. This is the discussion which we have to do. Okay, then do it. Yes, wait for some time. We have to discuss this also. The other part, yes. The base of the brain, yes. There you will discuss the dural venous sinuses, yes. Okay, then do it. Magnify. As you magnify, you will see there is some superficial middle cerebral vein. Where is it draining? The superficial middle cerebral veins. It is superficial, so it will drain to superficial circulation. Who is that? Cavernous sinus. Cavernous sinus is superficial circulation. Yes. So it is draining into cavernous sinus here. Yes. Okay. Lateral to pituitary gland. Yeah, lateral to pituitary gland, you have cavernous sinus and it is superficial circulation. So superficial middle cerebral vein. Yes. And superficial middle cerebral vein will drain to superficial circulation, which is, who is the deep circulation then? Deep. Deep is here, straight sinus. So you're telling that straight sinus is deep circulation? Yes. When you say straight sinus is deep circulation, can we discuss about deep circulation then? Yeah, of course. Straight sinus will drain to confluence of sinus, and where the confluence will drain into right and left transverse sinus, and where the right left transverse sinus drain into the sigmoid sinus, S-shaped sigmoid sinus, and after sigmoid sinus, S-shaped sigmoid sinus, where will you drain? Into internal jugular vein. Internal jugular vein. So most of the blood will actually drain into internal jugular vein. If you say most of the blood will drain into internal jugular vein, fine. But how the cavernous sinus will drain into internal jugular vein? If you want to drain the cavernous sinus, you use this. What? There is a petrosal sinus. What petrosal sinus? Actually, there is a superior petrosal sinus, inferior petrosal sinus. There's a superior petrosal sinus and there is inferior petrosal sinus. Yes. Where is this superior petrosal sinus draining? Into transverse sinus. And where is this inferior petrosal sinus draining? Into internal jugular vein. Where? Internal jugular vein. I cannot see nothing here. After you have put all the pen marks, I see nothing. Yeah, okay, fine. Let us make a clear diagram then. Then you will see. So, before you do that, let us just look at this question. Internal cerebral veins, they drain the brain. Internal cerebral veins, they drain the brain into. Internal cerebral veins will drain the brain. Yes, they are around the brainstem. They are going around the brainstem and then go behind the brainstem. So when they are around the brainstem and then going behind the brainstem, I think they unite. Yes. And form the great cerebral vein of Galen. Yes, great cerebral vein of Galen. That is your answer. Let us see the diagrams now. So they are around the brainstem, right and left side? Yes, around the brainstem, right and left side. Then they go behind the brainstem, join to form a single vein in the midline, and that is called great cerebral vein of Galen. Okay, so this is the answer. Yes. Can you show that in a diagram? Of course. That's the diagram. So this is the diagram which we have seen already. Yes, but you see it again. And this is the two internal cerebral veins, one on the right side and one on the left side. So there is a right side and there is a left side internal cerebral veins. Yes, they go around the brainstem and go behind the brainstem, and then they join to form the great cerebral vein of Galen. So this is the great cerebral vein of Galen now. Yes, that is the great cerebral vein of Galen. Then what is it doing? It is actually receiving inferior sagittal sinus. So you are telling that inferior sagittal sinus is now joining the great cerebral vein of the Galen. Yes, and together when they join, they'll form the straight sinus. So you're telling now they will form the straight sinus. Yes, this is the straight sinus. Now when they form the straight sinus, where the straight sinus will go? Into this confluence of sinus. Confluence of sinus. And what else this confluence of sinus is receiving? Along with the straight sinus, what else drain here? Actually, SOS tributaries. SOS tributaries. What is this SOS tributaries? I think the first S is straight sinus. Yes. The first S is the straight sinus. If the first S is straight sinus, then what is the other tributaries? What is this O for? Actually, O come from below, which they have not shown. O come from below, which they have not shown. Occipital sinus. Occipital sinus. So occipital sinus will come from below. Yes. And what is this other S? That is coming from above. Oh, you mean to say superior sagittal sinus? Yes, superior sagittal sinus. So coming from above, superior sagittal sinus. SOS tributary. Now all the blood is in the confluence of sinus. Where is it going then? When all the blood was in the confluence of sinus, it is going into right and left transverse sinus. Right and left transverse sinus. And when it is going to right and left transverse sinus, where is this going from there? Into this sigmoid sinus, S-shaped sigmoid sinus, S-shaped sigmoid sinus. And then where is it going? Right, see, right and left transverse sinus, right and left sigmoid sinus, and then right and left internal jugular vein. Right and left internal jugular vein. Yes, right and left internal jugular vein. Actually, there was a confluence of sinus and transverse sinus and sigmoid sinus and internal jugular vein. And what end? It will go towards the heart. All the venous blood goes towards the heart. Oh, it is going towards the heart now. Yes. Okay. Superior vena cava? Yeah, superior vena cava, whatever. We'll discuss that later. But at this moment, you see, this is a question asking. Falx cerebri. Falx. What is falx? Falx cerebri, you know, double fold of, yeah, dura mater. Yes, double fold of dura mater. Containing some dural venous sinus. Yes, containing some dural venous sinus. Tell me. So, falx cerebri is some double fold of dura mater containing some dural venous sinus. I know. Yeah, what do you know? I know there are three sinuses inside. Three. What are the three? There is superior sagittal sinus and inferior sagittal sinus and straight sinus. Where is straight sinus? It is at the base. What is base? Can you show me some diagram for the base? So falx cerebri has three sinus: superior sagittal sinus, inferior sagittal sinus, and there is a straight sinus at the base. Yes. You mean to say your answer is choice number A? Yes, choice number A. The answer is choice number A. Can you show some diagram for that? Yeah, diagram is coming. You are talking about dural venous folds and sinuses here, and this is the diagram. What is this diagram about? You see, this is superior sagittal sinus, and this is inferior sagittal sinus, and this is the double fold of dura mater, falx cerebri. So that is the double fold of dura mater, falx cerebri. Yes, it is having superior sagittal sinus enclosed inside, and it is having inferior sagittal sinus enclosed inside, and it also has the straight sinus at the base. If you remember, we have discussed that it is the inferior sagittal sinus which will drain into, it is the inferior sagittal sinus will drain into cerebral vein of Galen. So when the inferior sagittal sinus will drain into cerebral vein of Galen, what they join to form? The straight sinus, and straight sinus is at the base of falx cerebri. In the falx cerebri, you have three things. What are the three things? There is a superior sagittal sinus, there is the inferior sagittal sinus, and also the straight sinus. There are three sinuses in the falx cerebri. If you say so, fine. I think straight sinus is deep circulation. Yes, it is. Then cavernous sinus is superficial circulation. Yeah, that is correct. If you say cavernous sinus is now the superficial circulation, can you talk more about cavernous sinus, superficial circulation? Yeah, I'll tell you. Orbit is sending some vein into the cavernous sinus. Orbit is sending vein into cavernous sinus. Who is that? There is a superior ophthalmic vein and inferior ophthalmic vein. So this superior ophthalmic vein, inferior ophthalmic vein, they are draining into cavernous sinus. They are tributaries to cavernous sinus. Yes, they are tributary to cavernous sinus. And then what are the draining channel for cavernous sinus? The draining channel for cavernous sinus, yes, you know them already. What? You already have discussed. What was that? Superior petrosal sinus, inferior petrosal sinus. So superior and inferior petrosal sinus, yes. Where is superior petrosal sinus draining? Where is inferior petrosal sinus draining? That we will discuss, but if you remember, we have this confluence of sinuses, and then there is a transverse sinus, then there is a sigmoid sinus, and there is internal jugular vein. So this internal jugular vein, yes. Continuation of sigmoid sinus, yes. Continuation of transverse sinus, yes. Actually, first you have confluence of sinus, then you have transverse sinus, then you have the sigmoid sinus, then you have the internal jugular vein. So this is the orientation. Yes. Let us look at the deeper you have discussed, the superficial circulation now. Okay, then we'll do it. But the answer for this question was falx cerebri. Yes. Three sinuses. Yeah, but answer is here, straight sinus. Along with that, you have superior, inferior sagittal sinus also. Straight sinus is at the base. Now we are going to look at the cavernous sinus detail. Now if you're telling that it is a detail of the cavernous sinus, that is deeper circulation was actually straight sinus. We already have discussed the straight sinus, but now we have to move on to the superficial circulation, which is cavernous sinus. Let's do that. And which is here. So this is the cavernous sinus, yes. And this is the superficial circulation. What is the tributary? Tributary means incoming channel, yes. Actually, there was superior ophthalmic vein and inferior ophthalmic vein, which came from orbit. But remember, superior ophthalmic vein has bidirectional flow. What do you mean? It means it is not only a tributary to the cavernous sinus, but it is also a draining channel for cavernous sinus. You mean to say superior ophthalmic vein has bidirectional flow, and the orbit will drain into cavernous sinus, and cavernous sinus can drain into the orbit also? Yes, but only superior. So superior ophthalmic vein has bidirectional flow, but inferior is only unidirectional? Yes. And the orbit draining into the cavernous sinus? Yes. These are the two tributaries to cavernous sinus. Now, what are the draining channels? The draining channels, yes. We'll discuss three draining channels. So you want to discuss three draining channels now? Yes. Tell them. Tell about them. And you will find they are superior petrosal sinus and inferior petrosal sinus and deep facial vein. Deep facial vein. If you say deep facial vein, can you tell me where is the deep facial vein draining? The cavernous sinus. See, the cavernous sinus will actually drain into the pterygoid plexus, and pterygoid plexus will drain into the deep facial vein. So you are telling that first you have cavernous sinus, yes, then pterygoid venous plexus, and then deep facial vein, and then facial vein, then facial vein. So now the blood will come into facial vein. Yes. Tell me the circulation again. Actually, there is a cavernous sinus draining into pterygoid venous plexus, draining into the facial vein, draining into the facial vein. That is the circulation. And what about the others? Like what? Like superior petrosal sinus and inferior petrosal? If you say superior petrosal, inferior petrosal, neither of them will drain into sigmoid sinus. Though some books will say they drain into sigmoid sinus, but neither of them will drain into sigmoid sinus. If they don't drain into sigmoid sinus, then where are they draining? If they don't drain into sigmoid sinus, where are they draining? Let us see where they are draining. Understand that the superior petrosal sinus will drain into, yes, transverse sinus. Where? Into transverse sinus. So this is transverse sinus there? Yes. And you are telling that this is the superior petrosal sinus? Yes. So superior petrosal sinus drain to transverse sinus? Yes. Not the sigmoid sinus? No. Then where is the inferior petrosal sinus draining? Inferior petrosal sinus, if you say it is draining into not the sigmoid sinus, then where? Into this vein. It is the first tributary. So this inferior petrosal sinus is the first tributary of this vein. What is this vein? That is the internal jugular vein. Remember, inferior petrosal sinus is the first tributary of the internal jugular vein. It is not draining into any sigmoid sinus. So you are telling that the inferior petrosal sinus will not drain into sigmoid sinus, but is the first tributary of the interjugular vein. Yes. And now remember, there are some problems, dangerous area of face to discuss. What about the dangerous area of face? When you discuss the dangerous area of face, any infection in the dangerous area of face should be immediately taken care of. Otherwise the Staphylococcus aureus can enter the cavernous sinus. What are you talking about? A nasal pustule? You mean to say some pustule on the nose? Yes. Dangerous area. So some dangerous area of the face, nasal pustule on the nose. Yes. What about that? Which is the most common bacteria? Staph aureus, and it is multi-drug resistant also. Do you know? Of course, we know what are you talking about. Yeah, okay then. Multi-drug resistant Staph aureus can be on the skin and in the dangerous area of face. Be careful. Treat it properly. How do you treat it? Whenever you find an infection in this area, immediately give. What give? Give which drug? Which drug will you give? Of course, amoxicillin. But don't give amoxicillin alone. Give with clavulanic acid, a combination to kill the bacteria. So amoxiclav, yes, just give it. Why? Because if you don't give it, then see what happens. Staph aureus is now entering where? Staph aureus is entering the nose. It was in the nose. Now it is entering the facial vein. And from the facial vein, where it is going? Staph aureus was in the facial vein. Now it is going into angular vein. What is that? Angular vein. At the angle of the eye, there is angular vein. Okay, angular vein. Then superior ophthalmic vein. Superior. Why not inferior? No, it can go into inferior, but usually superior. Oh, usually superior. Then cavernous sinus pathology. Oh, cavernous sinus thrombosis. Yes. Understand that bacteria mostly use superior ophthalmic, but it can also use the inferior ophthalmic. So inferior ophthalmic vein can also be involved to carry the Staph aureus into cavernous sinus, causing thrombosis. Yes. Sometimes even the deep facial vein can be involved. So sometimes even the deep facial vein can be involved. Yes. But these are the three veins which are involved. So you're telling that whenever there is some nasal pustule, the Staph aureus might enter facial vein. Yes. And deep facial vein. Yes. That is angular vein. This is angular vein. So this is facial vein, then this is angular vein, then superior ophthalmic vein. This is the most common route, yes, to cause cavernous sinus thrombosis. Though the bacteria could also use inferior ophthalmic vein to enter the cavernous sinus, or the bacteria could have used the facial vein into the pterygoid plexus, into the cavernous sinus, causing thrombosis. This question has come now, and see the question now. As you're looking at the question, you'll find for cavernous sinus thrombosis, got a question. This question is asking, there was a septic emboli where? In the facial vein, which is causing cavernous sinus thrombosis. So, because facial vein has some connections with the cavernous sinus. So, which is the most commonly involved? Most commonly, yes. Actually, understand, any of the four can be involved, but most commonly superior ophthalmic vein. That is your answer. So most commonly superior ophthalmic vein, that is your answer. Otherwise, could be deep facial vein, yes. Could be inferior ophthalmic vein, of course, and could be in pterygoid venous plexus. How come? Because we have learned nasal pustule, yes, deep facial vein, and pterygoid venous plexus, and cavernous sinus thrombosis. So you're telling that nasal pustule will send some septic emboli into deep facial vein? Yes. Into pterygoid venous plexus? Yes. And into cavernous sinus thrombosis? Yes, that is the point. But answer remains choice number A, superior ophthalmic vein.